So this is the room where we're going to do your MRI scan. This machine is going to take pictures of the inside of your body so we can figure out what might be making you feel sick. Do you want to come check out the machine?
Okay.
So this is the scan table you will be lying on, and the table will take you into the machine to take pictures, okay? I know it looks kind of scary. I have this eye mask that you can wear if that makes you feel better. That way you won't notice how tight the space is. Want to give it a try? How's that?
Good.
Do you want to wear it when you go into the machine?
Yes.
I also have something else that might make you feel more comfortable. Do you want to choose a squishy ball to take into the machine with you?
Sure. Can I have the red one?
Okay, can I have you lie down here? I'm going to place this around your chest, okay?
Okay.
We have to measure your breathing for some of the pictures, so this strap will let us do that. So when you go into the scanner, you're going to hear a voice that will tell you to breathe in, breathe out, and hold your breath. Let's give it a try. Breathe in. Perfect. Hold your breath.
Oh, sorry.
It's okay. Try it again. You hear hold your breath. I want you to hold it for 10 seconds, kind of like when you go swimming, like this. Okay, now you try. Breathe in. Great. Hold your breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now breathe out. Perfect. Do you have any questions?
Nope.
Okay, now I'm going to put this around your stomach. We will use it to take some of the pictures. It's like a blanket and it won't hurt you. Okay, you're doing great. Are you okay?
Yep.
Right now I'm connecting you to this contrast machine. When we start the scans, this machine will inject a medicine called contrast medium inside of you. This machine is like a highlighter for the inside of your body, and it will make the images of your body appear more clear. It won't hurt, but after a few seconds your body might feel cold and you might taste something weird in your mouth. You might also feel like you peed your pants, but this is all totally normal and the feeling will go away in less than a minute.
Okay.
I will let you know when the injection will happen, okay?
Okay.
Last thing before you go into the machine, this over here is the emergency squeeze ball. I will put it in your right hand like this. If you need to stop the scans for some reason, you can press this and I'll come take you out. But only press this if it's an emergency, because if we stop the scans, we'll have to start all over. So as much as possible, we want to try to not use it, but if you really need to stop the scans, you can press this, okay? Can you tell me when you should press this ball?
Only if I really have to.
Exactly, only if it's an emergency. Okay, so when you're ready, we'll put on your headphones and your eye mask and we'll bring you into the scanner. Becky can stay with you if you want, and I will go into the control room over there. You can keep a hand on him while he's inside to reassure him that you're around. Does that sound okay to you?
Okay.
Okay, so first we have to take some initial pictures before we start the injection. The first picture will be very short, and then there will be some longer ones. I need you to stay very still so the machine can take good pictures. Are you ready?
Okay.
Relax.
So we're all done with the first scans. You did great. Now we're going to move on to the next set of scans. We're going to do some scans where you hold your breath. After we're done with them, we're going to inject the contrast medium. Like I said before, you might feel a little funny, but that feeling is normal and it'll go away very soon. Right after the injection, we'll do some scans where you hold your breath. Are you ready?
Yeah.
Okay, here we go. Alex, I'm going to need you to hold your breath like we practiced earlier. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, that was great, Alex. Now the computer is going to tell you when to hold your breath while we take more pictures.
Breathe in. Hold your breath.
That was great. Okay, now we're ready for the injection. Remember, the computer will let you know when to hold your breath while we take more pictures.
Hold your breath.
You're doing awesome, Alex. The scans are starting, so just stay very still.
Relax.
Okay, Alex, you can breathe normally now. You did great. I'm going to come in there and get you out.
An important takeaway here is to take the time to explain the procedure to the patient and why they need the procedure in clear and simple terms. The MRI room can be an intimidating place. It can be helpful to show the patient around and to have them explore the equipment a little before getting started. Also, don't be afraid to be repetitive. It can be helpful to demonstrate to the patient what you're telling them to aid with comprehension. For example, in this video, the MRI tech provided a demonstration on how the patient should breathe when pictures are being taken. Address any concerns your patient may have. Ensure that the patient is at ease and ready for the procedure before asking them to get on the scan table. To help the patient feel more comfortable, you can ask them if they would prefer to have the lights lowered, offering a squishy ball to squeeze during the exam, or providing an eye mask for patients that are sensitive to tight spaces. Finally, some hospitals will allow a caregiver to be present in the MRI room if the patient is anxious, but try to allocate extra time if you can so the caregiver can be screened and change.